Facebook. Hawezi pata link. Link naweza kusubscribe lakini kama naweza post. You see how okay, let's just go. Let's use the YouTube for now. That medicine
so we have
download hizo presentations kwa square.
and what is the link for YouTube? Just set Kpsa.
So again, download it. You can open this the so nani ana which one am I saying? This one. Share your screen.
Tunasort bado, hata nitakuwekea kwa Facebook. Yes. Itakuwa sawa sasa. So we share.
Not Facebook, only YouTube. Let's go with YouTube. Tumia wiki ya share pia.
Tunatumia Facebook na hiyo ya kwanza, Facebook na hiyo.
Hii naenda YouTube. Ukiklik kwa hiyo link unaingia. Sawa.
Inaitwa hiyo ingine, National Committee.
Na pia
Walikuwa wanasema basi. Mama, umeshafanya sijashare?
Thank you. So are we going what we can see unaweza jiweka Iran. Make a post. At least kidogo tumebaki na control. Make a post. Unaweza delete 9 minutes. Oh. Yeah, minute 4.
So let me wait on the back, then I'll do it.
You tell them they can use the
YouTube. The link.
the link has been shared on the WhatsApp.
Yeah,
It's a big,
I need
it's a
to
big
read.
link.
No, link in here. So they check WhatsApp.
Sorry? Na hiyo nyuma tunadoni. Sawa. Hata naweza tumia tu. Naweza songa tu ya. Sawa.
Okay, we are ready to resume. Keep it on. Okay. Thank you, directors, for your patience. We will now resume our presentation with Dr. Anne Mwangi. We do apologize for the technical hiccup, but now we are live on YouTube. Facebook, we shall endeavor to see how it will work, but at the moment we are live on YouTube. And for those who are able to access the link of the Zoom meeting, you are welcome to join us. Thank you very much, and we sincerely apologize for the delay. Welcome, Dr. Anne Mwangi.
Thank you very much for your patience. We continue from where we were. I will try to make it very quick now so that we can finish. We were talking about masks, and I just, in my last slide, I had just talked about, shown you a picture of a cloth mask, which have become common now, and even the cost of the masks has gone down significantly, so the parents can actually afford to get at least maybe 3 or 4 masks for the children as they resume school. So one of the things about cloth masks is that they are usable masks. You can wash it and then reuse. They are cheap, and but they need to be made with a tightly woven material. It should not be the material that you can see through, it should be a tight, actually the preferred material is cotton, because cotton is tightly woven, so that they also protect the droplets from passing from one person to the other. They should be of adequate size to cover the nose, the mouth, and the chin. So if your mask is only covering your mouth and not your nose, then that is not the right size, including for the children. And it should be multiple layers, at least 3 layers, a layer on the outside, one on the inside, and a middle layer. And for children, when they resume school, good practice, the mask should be washed at the end of the day and left to dry in direct sun. So no child should come wearing a dirty mask, because a dirty mask not only can be a source of infection. Like I said, the reason we are wearing masks is to protect us from the virus. So the outside of your mask, by the time you're getting home or your child is getting home, it's already presumed to have the virus on the surface. So the child should not put their mask in the school bag and wait to put it on the following day. The mask should be washed every day, and that's why even as schools are reopening, children, if they are going to be using the cloth mask, they should have, if possible, 5 masks to wear every day of the week. If it's not possible, maybe 2 to 3 masks, so that they can wear one and leave the other one at home to be washed and hanged to dry. And probably even carry an extra one in their bag in case the other one, maybe the strap cuts off and they have nothing to wear when they're in school. We should completely discourage the wearing of a dirty mask. Even the surgical mask should be worn once and discarded. This is just an example of a surgical mask. I don't know this company. I only picked this from the internet, so I am not advertising their brand. And then that is an N95 mask. These are commonly recommended in hospital settings, especially or for people who may already have the coronavirus and they are being nursed. But we ideally wouldn't recommend that you tell parents to buy N95 masks. They are expensive, and they are also not, you can't use it for a long time. You can use it a little bit longer. It can be kept in the sun to kill the bacteria, but the virus, but it is not recommended that that is the kind of mask that parents should get for their children. This is how a mask should be worn, covering the nose, the mouth, and the chin, and should be worn throughout. It should not be worn a short time, removed, kept down, put on the chin, put on the forehead, or any other part of the body. Disposal of face masks. Single-use masks, like I said, should be disposed of in a closed bin. So the schools should have a closed bin, because you will still see disposable masks in the school compound. Some children will come with it, the strap will cut, it will be left on the floor. Some will forget it on the floor. This is going to be a common occurrence. Just like the way we have clothes which we call, I don't know how you call them in your schools, but I know every school has a place where clothes which are lost and found are kept. So you'll also see masks that are lost and now they have been found. You don't want someone to come claiming this was my mask while it has been lying on the floor. So we need to have disposable bins. This mask, any mask that is found lying on the floor or in the compound should be treated as infectious. Picked by a person who is wearing gloves, disposed of in a closed bin, and treated as infectious waste. And then I think that I've already said my last point, that masks found lying around should be treated as infectious. There's a category of people who should not wear a mask. Luckily, we don't expect to have 2-year-olds in school, but a child below the age of 2 years should not wear a mask. Anybody who has trouble breathing, like if you have a child maybe in school who has trouble breathing for any reason, they should not also be forced to wear a mask, because that will compromise their oxygen supply. Somebody who is unconscious, incapacitated, or will not be able to remove the mask. So again, we need to take that into consideration, because you can also have an emergency in the school. Maybe someone falls, they're unconscious, not necessarily because of COVID. We have had emergencies in school before even COVID. So you should not force them to also wear a mask on top. The other people who are handling them should be the ones wearing the mask, but that person should not be wearing a mask, whether it's a child or any other member of staff in the school. Special consideration for masks in school. We have a challenge. I know we even have a lady from special education. In children who are deaf or hard in hearing, we know they read the lips. So like if you're teaching them, probably the school may consider a face shield as opposed to a mask, because if they are reading your lips, then you have covered them, it becomes difficult. But this is again even for lower primary, where we are teaching them language, and they need to see how the words are pronounced. When I was in school, we were never taught those things. But nowadays I've learned there's something called sounds. So you have to see how the mouth is moving and how the sounds are coming out. So those are some of the considerations that schools should make. For lower primary, baby class, those teachers who are teaching small children, you may opt to get them face shields to protect them from pushing the virus to the children in case they're infected, but also protect them and the children, but still allow the children to be able to see the face, the lips of the teacher as they are teaching. Children, people with intellectual and development disabilities, mental health conditions may have challenges wearing masks because this probably they don't even understand why are they even wearing a mask in the first place. So again, where challenges of wearing masks exist, then we really have to keep the social distance. We really have to emphasize on social distancing where there are challenges wearing masks. And then the children in preschool, I know we all need to have all our children wearing masks, but it is definitely going to be a challenge for children in preschools because they may not wear a mask properly, they may not wear it for a long time. So again, teachers will really have to be innovative, maybe to sometimes move out with the kids and learn maybe outside so that they can put them on different places and they don't have to wear a mask because they are small children and they may not be able to be on a mask for a long time. So these are just considerations people may need to think about. We are still working on it as well with the Ministry of Education because really small children like the ones we take to school at 3 years, they can wear a mask, but they may not be able to be on it for a long time. When people are going for swimming where the masks are likely to get wet, again, it may not be possible to wear a mask. Hand washing, I don't want to go into the details of hand washing, but as I said, soap, any soap is adequate for hand washing. You starting by washing the front of the hands, then the back of the hands, and then the tips of the fingers, then the wrist and the thumbs, and ensuring that every surface of the hand has been thoroughly scrubbed and drying in the air or with disposable towels. I think that's just a picture which we can also get from the internet. And children should be encouraged to wash hands as many times as possible in schools before eating, even if it's a snack, after sneezing, after coughing, after using the toilets. I think that's already a practice that we do. After touching contaminated surfaces, if they go to the computer lab where they are touching shared equipment, after coming from outside for a break, they should come back and wash their hands before they. So we should create hand washing as many times as possible within the school. That means availability of water and soap. So I don't want to go into the details of how to sanitize, but one of the things is once you put sanitizer in your hands, you should rub it until it is dry. It should not be rubbed and then you wipe maybe with your clothes and assume it should be rubbed on the hands until it dries up. So these are just some examples of face shields that schools can consider, especially for teachers when they are teaching. If small children also can wear a face shield, especially those ones in preschool, because a face shield also allows a bit of breathing room. Social distancing at least a meter, that's just a picture. So now we come to the gist of the matter. What is the response for schools? One of the things that every school should endeavor to do, and I believe this is part of the Ministry of Education guidelines, is to have a COVID response team, even a COVID focal person. Like if you have 5 people who are the COVID response team, every day you know who is responsible for COVID issues. And the COVID response team, they can agree how often to meet and how to discuss and what issues, because this disease is new, we are all learning. I know when we started, the way we started in March is not the way we are now. So the COVID response team in school is to ensure that everything is running as planned, and probably who shares that can be agreed upon could be the head teacher, but there should be a COVID response team and a focal person who is in charge of checking that everything is working as planned within the school. Temperature screening should happen at the entrance to the school. I know we have seen that happening even here, and note down the temperature of every child, so that in case a child has a high temperature, then the immediate response is done. Hand washing facilities will really depend on the population of the school. If the school has a huge population, the recommended one is about one hand washing facility for every 25. That may be In a school with a big population, it may mean a lot of hand washing places. But again, this can be, the school can check what is really adequate for them and where these hand washing facilities are going to be at the entrance, around the classes, at the dining area, at the dormitories. But we need to have multiple hand washing places so that even wherever you pass, if you need to wash, you can be able to wash your hands. Hand sanitizing, the same, multiple places with hand sanitizers. Ideally, not the portable ones. It would be better to have the ones that are fixed so that you just pour the hand sanitizer inside and it can be used at fixed spaces. Maintaining social distance in classes and all the other places, in the dining, in the dormitories for those that have in boarding schools, in the laboratories. And it's not just social distance when you're inside, but even when they are walking in and when they are walking out, so that as children are walking in, walking out, they are maintaining social distance. The wearing of masks, as I said, by all learners, by teachers and other members of the staff. And not just wearing a mask, but wearing it correctly, so that it's not being worn and the nose is out, or being worn and it's on the chin. Let's try as much as possible to ensure that our schools are wearing the masks correctly and consistently. Regular cleaning and disinfecting. We talked about disinfecting, especially commonly touched places. Cleaning is happening, like if the dining area kids have come, they have had their meals, then somebody cleans and disinfect. And disinfecting is using like jig or any other bleach solutions mixed with water in the right proportions, with a towel, and the surfaces are wiped, like the dining tables, the chairs, everywhere that children may have touched as they were having their meals. And the other one is reducing the number of visitors in the school. Definitely, because we don't know who could come in and has the virus. And of course, if they come, they have to also observe the measures. Clean their hands, sanitize, they are wearing their mask correctly. If they are coming to speak to anyone in the school, maintaining social distance. So that needs to happen at all times. Then cleaning and disinfection of the classrooms at the end of the day, disinfection of the desks where the children were touching the whole day, disinfecting the doorknobs and everything, so that as the children are coming in the following day, the classes are clean. Then there's the bit of fumigation. Fumigation, especially, I know the Ministry of Education recommended fumigation for the schools that had previously been used as quarantine facilities. Sometimes the fumigation may also be recommended in schools, especially if you have identified a positive case. If you identified a child maybe in grade 1 or whatever grade, and they have been evacuated and taken to hospital, then we may need to fumigate that classroom before the others. The other one is the holding room. Every school is advised to have a holding room. This is a room where if I develop high temperature when I'm in school, as the school is planning how to evacuate me to hospital, then there's a place where you put them. And that holding room, as soon as that person has been evacuated, should be fumigated. And the school also needs to have emergency contacts with which they can use to call in case they suspect COVID in the school. Linkage to a health facility, every school should have a link. I know, like for at least for every school somewhere within this country has the nearest health facility. That would be the most advisable to the nearest health facility. In private schools, you may also have to have the parents' contact. I know you take them, so that in case you discover that the child is not feeling well, you can call the parents, and the parents sometimes are also able to advise where their child can be taken for emergency care. So that should happen. And so it also means maybe having organizing to know what ambulance services to use, who are more available. Do you use a government ambulance service, or do you use a private provider of the service? Then we have the personal protective equipment, and this is specifically important for emergency response. The emergency response, if somebody develops symptoms that are COVID-like symptoms, then the person handling them need to wear the PPE. So they may need to wear the PPE, and of course, psychosocial support as well. I'll show you a PPE in the next picture, in the next slide. Psychosocial and mental health support. So schools should also create opportunities where children can discuss their fears. We know some children have also gone through a lot of trauma during COVID. Some have had relatives pass on, people they knew pass on from COVID and from other things. Some have gone through traumatic experiences where they are away from school. And I think it's good for schools to be those safe havens where children can open up and discuss their issues, including their fears about COVID. I remember when schools closed, and that was just like a day after COVID was discovered, or 2 days, my son, who is in high school, came home and told me he really feared for us. I don't know, he thought maybe by the time he comes home, he'd find all of us have COVID, but he was really fearing. He told me, the biggest fear I had was for you people. Like, so children fear, and sometimes they internalize those fears. And if nobody talks about them, they can internalize, and it becomes something that affects them even later in life. So the schools should create opportunities for children to speak, and even to have someone who can actually listen to them and support them while they are in school. Then the other one is this education, information, and communication materials in schools. I know this will work closely with the Ministry of Education to ensure that we get IEC materials in schools, posters put in strategic places. Some schools may even be able to get drop banners like the ones we are seeing here, where they can put and just what are the symptoms of COVID, just information. As children are in the compound, they can read, they can see how to respond to the COVID. School transport, I know most children in private schools also use school transport. Again, ensuring there's physical distance when children are on transit to and from school. Sanitizing facility within the school transport, and also ensuring that the transport is cleaned at the end of every session, and then also disinfecting, like the seats, the rails where the children touch, the doors, and that they are kept disinfected at the end of every day. Last but not least, reminding our children, our members of staff, our teachers, and everyone else that if you're not well, don't come to school. You don't have to come. And also being flexible enough that if a member of your staff is unwell, that someone else can take up their duties as they are recuperating at home. And if they are very sick, then also going to hospital and getting medical support, so that we also don't lose people as they stay at home waiting to recover when they are at home. So I think those are some of the key things that schools need to do. Last but not least, I said I would show you a picture of a PPE. We have seen this a lot. I'm sure this is not something we have not seen. Wearing a gown. This may be some of the things the schools may have to get, because if a child gets sick and they're in school, the person taking them to hospital has to be has to be protected. Gown, goggles, surgical mask, ideally N95 mask, if it's possible, or just surgical mask, gloves, a face shield or goggles, and then boots. This may only be needed for the person who is probably rushing the child to the hospital, depending on the setup of the school. So we know that there's a lot of stigma around COVID. Again, as admins, ensuring that the stigma about COVID is reduced, because when people are stigmatized, they fear to talk about it. Even when someone is feeling unwell, they are scared. If I say I'm feeling unwell, everybody will label me COVID. So we know that many people have not even been calling COVID the disease. They say that disease, that one, the one, he got that one. So just ensuring that we reduce the fear that is being associated with COVID, especially in our school setup. So we know that vaccine will still not be available, maybe in another year, maybe in another few months. So we still need to be cognizant of that. There's not much evidence on the antiretroviral drugs that are currently being used. And there's still high likelihood that we'll still have COVID even as we are opening school and even up to next year. We pray and hope and believe that COVID is going to go down, but we still know that it may be around with us for long. It might actually be here for much longer than we anticipate. So the best thing to do is prevention. And then just to address anxiety, this is a quote I picked. Children will look to you when deciding how to feel about COVID. In fact, children look at their parents when deciding how to feel about everything. If they find you are fearful, if they find you are calm and prepared, they will be calm and prepared. If they come to the school and find everyone is calm and prepared to receive them, the children will also be calm and prepared. If they find that you are scared and running helter-skelter and looking so scared of them, they'll also be scared. So we have to create an environment of calmness, an environment of peace, so that our children can come to school and learn. If the school is prepared to receive our children, even the parents will stop fearing. But if they come to the school and find you're not prepared, these are the ones who are saying, oh, mimi bado nagoja, sijarudisha mtoto bado nagoja. So let's make schools a place where us as parents can bring back our children and believe that you're going to take good care of them. Thank you very much. That's the end of my presentation. Thank you for the time.
Thank you very much, Dr. Anne Mwangi. You may have your seat. We shall be answering questions. Oh, allow me to remove my mask. We shall be answering questions during the plenary session. That will be after our next speaker. Before we have our next speaker, just to summarize what Dr. Anne Mwangi has said. To summarize, it's a lot of technical issues, but let us summarize. To summarize, I would say avoid men. And I know you're wondering, why is she telling us to avoid men? And the avoid men means avoid touching your mouth, avoid touching, that's M for mouth, E for eyes, and N for nose. That is why you have to wear your mask. Embrace women. Embrace women. We are good. Do I have to say it? And all the men say amen. Embrace women means W, wash your hands, or obey social distance. M, mask your face so that you can cover the men. Are we together? E, exercise and eat well. And N, no unnecessary overcrowding. So avoid men, embrace women. Thank you very much. That is in summary of all that the doctor has said. For those with questions, at the end of this session, we will answer them. Keep posting questions, keep posting your comments. I know somebody's looking at me. How can I avoid a man? I'm not talking of the real man. I'm talking of the acronym. Now, allow me to continue to acknowledge we are quite many watching on YouTube. We are watching on YouTube. And for those who are able to link, we are over 100 on our link page. Allow me to welcome everybody watching us from all over the country, from the sunny beaches of Mombasa, to the Ngong Hills, to the watery lakes of Lake Victoria, to the snow mountains of Mount Kenya. Everybody welcome. And let us continue. Our next speaker is Anne Gashoya. She is from the Ministry of Education. She's going to highlight on the guidelines on health and safety protocols for reopening of schools. Welcome, Anne Gashoya. And as she comes, for any question, for any clarification, directors, school owners, feel free to post there. Later on, we shall be able to give your feedback. We still apologize again for starting late because of the technical issues that we had. Welcome, Anne Gashoya.
Ile ulikuwa umeweka hapa one time, niliona ulikuwa umeweka. You changed it when you are trying. It's in it. It's called presentation. This one. So good afternoon, everyone. I can wear my mask as I wait for the team to leave. So it's my pleasure to speak to directors of private schools in the country. And I want to acknowledge the role played by the private sector in contributing to provision of quality education for the children of this country. I want to take you through briefly the guidelines that the Ministry of Education developed. And these guidelines were drafted by the National COVID-19 Education Response Committee, a subcommittee where none else than Peter Doro, who is the CEO of Kenya Private Schools, was the chairman, and I was the secretary. So it is actually a combination of all our efforts. We also had the officers from the Ministry of Health who are also guiding us in this aspect. Because of time, I will not take you through the genesis, and you all know the genesis, and we'll also be having this presentation with you so that you are able to read on your own. But it is important to point out that the ministry developed the Kenya Basic Education COVID-19 Emergency Response Plan in May, because immediately the schools were closed. The next was to do a plan in order to come up with some interventions which are going to help us recover, respond, and recover from COVID-19. That plan is in the Ministry of Education website. Kindly have a look at it and read. I will not also take you through what the committee responded, because the CS appointed a committee, and the implementation on what we can now witness of even the phased reopening was one of the recommendations of the committee. The others, you will be able to look at them. What I want to say is that the rationale why we did this guideline was simply to provide prevention, early detection, infection control, and the management measures of COVID-19 in educational institutions once schools reopened. Now the schools, we have started phased reopening because we started with grade 4. We also started with class 8 at the form 4. And the other thing we need also to get clear is that we don't have any education problem. What we have is a health problem, which we are having as a country, and it has affected education. For that reason, there is need for each and every one of us to understand these measures, to understand what Daktari has taken us through, to understand what we need to do in order to prevent. That is why even as we leave this place, we need to become ambassadors, and they talk about it, the prevention measures. We need our teachers to understand clearly. We need our teaching staff, non-teaching staff, our parents, because some of these children are basically 70% of our schools in secondary schools are day schools, while close to 99% of even primary schools are day schools. So remember, these children will be going home at the coming. The non-teaching staff, the teachers, will also be going home at the coming. So it's like we shall actually be exposed to the risk of getting infected, because we are moving to different directions. Hence, needed to understand. The same thing with the COVID, because it's a health issue, we need everyone to, we need to fight it from all sectors, from every person's point of view, because even if at school we are washing our hands, even if at school we have put all these containment measures in place, and we are even complying, but as we go home, the parents, they don't know we need to wash, children need to wash their hands, they don't know what need to be done even at home, even as they go to school, even as they go to the shopping sector and all that. So it's a thing for everybody. If it is that driver who brings these children to school, that driver should understand clearly that these measures being put are meant to protect himself and the others. Because once we all understand that, we are able to progress well. So that means that for safe reopening of schools, we must bring everybody on board. And we are glad that we are here today so that we are able to see, especially the basic infrastructure that need to be put in place. Daktari has taken us through all that. And we also need to work with everybody, the private sector. I'm happy KCB, some partners have actually come in very strongly to support this process, because it is not a one-person thing. It is something that has come. It has not happened before. So we must join hands, effort, and we fight it from the basic perspective. For safe reopening of schools, we had come up with some few things that we need to do. One of them is, of course, we need to adjust as education managers, as investors. We are the people who are actually leading in the whole process because it's about adjustment of infrastructure. When we talk about physical distancing and all that in the classrooms, in the dormitory, in the dining hall, and even at the water point, these are areas we call them common shared areas where children will be meeting many times. They meet in classrooms, they meet in the latrine toilets, they meet when they are washing their hands in the dining hall and all that. So as investors, what we need to do is to invest more in those areas so that we make sure that learners are not congesting in the classrooms, so that we maintain that social distance of at least one meter, and they are not in contact with one another. It also means we are going to reorganize our school programs. In some cases, for example, so that they don't meet like in the dining hall. You need to reorganize the school program. When class A are having their breaks, class B should be in class learning. And that, by so doing, you ensure they don't meet in the toilet. You know very well children learn to the toilet break time, and they go all of them. Because you don't want that, you also don't want teachers to meet in the staff room at the same time. So what do? You have to reorganize some of the program so that you make some spaces and you make sure that these people are not coming at the same time. I'm not going to repeat about learning water. That one has been emphasized. And also the hand washing points you have been told, and you'll also be able to read on your own. Initially, we had been told liquid soap, and we are also getting still new knowledge. So let's have soap. Let's also have hand sanitizer. Let's all of us wear the mask. And Daktari has said, in fact, what we are saying is that what Daktari will confirm this. This sanitizer you see, it's not that you sanitize the whole day. If you sanitize 1, 2, 3, 4, the 5th time, you must look for adequate running water and the soap. It is not that because you are told in the absence of water and the soap, you can sanitize the whole day. Apana, we must also look for water. Hand sanitizer is, you must be able to use them where necessary and not to make them like it is what you are going to do. So as investors, we also need to invest. Thermal guns are very important. It is not for testing. These thermal guns are not used for testing COVID-19, but they are used for monitoring the temperature in order to monitor the symptoms, whether somebody has symptoms of COVID-19 and all that, including other diseases. Basically, I find this a very good way because even if there was no COVID, this would still be good because we don't need to have children who are perhaps sick and all that, and even non-teaching staff and the like. So as investors, let us ensure that as children come back from home and they resume studies, that we have invested in this area because it is indeed very key. Detergents, of course, Daktari said we must do daily cleaning, especially of the most frequently touched objects and the services, including the classrooms. Everywhere we must do that cleaning. So how do you clean if we have not invested in the detergents? So this is another area that we need to invest in: detergents, disinfectants, and all that. We must also be able to establish these referral systems. I know that one you'll actually basically do. We must also be able to, in our schools, that response committee, the institutional response committee is very key. In the guideline, we have even given a guide on who should be members of this response committee, which is very, very vital. So let us ensure that one is also there. It is also part of surveillance mechanism because it will connect with the sub-county response team. It will also be connecting with the county response team and the national response team. What the parents want is that confidence. Let's build that confidence. It's about building the confidence that the measures School A has put in place are adequate for our children to be guaranteed of their security. Remember, in all these things we are doing, the health and the safety of the runners, the teachers and teaching staff remains fundamental, because if they are not well, then they cannot even run. That means their health and their safety remains key to us, and we can do anything possible to ensure that that one is taken care of. So those mechanisms, once parents have confidence that even this is going to happen, in case someone is sick, response will be done very quickly, not like learners will stay for 3 days without even being taken care of. If they know, it will just be immediate. If the temperature is at 8.5, something will be done. Parents will have that confidence, bring their children to school. We are very happy with the response that we have seen and all that. The procedure for handling suspected COVID-19 case are also actually given, and even the promotion of blended learning. So for safe reopening of schools, we are expected to do all that. And then, of course, there was the flattening of the curve that we were to look at before we reopen our school. We are not going to go to that. But what I want to go to is other things that leaders must do, because we are leaders, we are education managers, we are directors. What we need to do. One, as directors, we need to give the strategic direction within COVID-19 context in our individual learning institutions. We need to give that direction that is so much required by everybody. We need, like now, if we go back, we ensure even our staff, even our learners, as they come back to school, they are aware of the prevention measures, the control, and even the management. And the key thing is making these people know these measures are to protect own self. That is the key thing. Even if the parents, when we tell them don't go to school, we are not entertaining people in school within this context, they should understand it is basically even to protect themselves and all that, and to protect the learners, because the learners are our key focus. I do not want people who have gone everywhere to come to the schools and they leave the virus. And you know, our children, even the young one, they can go picking things on the floor and then they get infected. The other thing as managers, directors, that we need to do is that in our individual institutions, we develop clear and specific policies, procedures. We have these guidelines which we have already shared with you. I know Peter shared with you. These guidelines are there. They are supposed to guide you also in your own institution, because schools also have unique characteristics. Some schools are even day schools, others are even boarding and all that kind of thing. So I would not tell you to do a boarding facility when you don't even have that boarding facility. But the institution which has boarding facility will just pick these guidelines and domesticate and do a tailor-made protocol. Now this is our protocol, Plainsview Primary School. This is our classroom protocol. And then while observing what is provided in the guidelines. Guidelines are there to guide people. They are there to guide us, and we need to do that. If it is dining hall, if it is sports, how shall we be cleaning our services? How? And we make everybody understand this. How shall learner movement protocol? Learner movement protocol. You see, like you will be moving. You see, we are being told by health, we should have some different pathways, marked pathways. Where children know I should not pass through here if it is class 1. This is the route, class 2. This is the route. So that even if one of the child is unwell or is suspected of COVID-19, you will be able to trace, contact tracing. You will even be able to trace, and you'll be able to help these children. Spiritual guidance, psychosocial, we also need those protocols. We domesticate institutional-based protocols. We also don't want to micromanage as such, because our setup is also different and we have different needs and all that. Based on that, one of the slogans that we should have, and the doctor has really emphasized on this, don't even come to school if you are unwell. Let that person get advised. that you don't have to come back to school. Of course, you'll advise them to go to the hospital and then stay at home until they are well. So that one about the learner movement protocols, that one you will do. We don't have to go to that. Other investments, directors, that we need to do, like water. For me, I think water, there's no compromise. Water, our schools must just have water. Water, that is key. Because water, we even use it to drink. So you can imagine school without water, and children are thirsty. We use water to drink, we use water for hand washing, for loudly, even for food preparation. So we basically just have to invest in water. The other is that we need to stock our institution with all these key supplies. I'm not going to repeat them. Let us stock them. Let's also maintain data for our runners. Let us even know their parents' details and all that. Our runners' detail, let's maintain that. And even those surveillance mechanisms, among other things. Basically, within the context of COVID, we shall have to adjust our budgets. We shall definitely have to adjust our budget in order to reflect the current priorities. As private school investors, I'm sure you may have wanted perhaps to do a BCD, but within this period, you now need to readjust so that whatever you are doing is related to this response, because we have now an emergency that we must address and deal up with. Of importance is that we should continuously develop the capacity building programs for our staff and even learners. It's about the behavior change. It's about the behavior. And you know, with the behavior change and these healthy protocols, it's like you need to be continuously reminded. You need to be continuously reminded. So let us do that. As much as we also ensure in our schools we have guidance and the counseling protocols. The other thing Dr. Ali has also mentioned is about these communication messages. Let's ensure in our institutions, those messages are all over. This is because even if you had forgotten to wash your hands when you are coming out of the toilet, and then you find somewhere, wash your hands, you will even go back and wash your hands. If you had forgotten, you are supposed to maintain social distance, and then you find a message, maintain social distance. Definitely, you remember. Even that, avoid touching your eyes, nose, and the mouth. You need to constantly be reminded. So these messages, let's have them everywhere as much as possible. This is about, I think this has been talked about. Let's also ensure we are not allowing children to share pencils, pens, toys. Like in the protocol, we have even said, let's not have toys coming from home. So that is also another area that investors, we need to invest in about the toys. Let the children use what is available, whatever is available in school. If they don't have, let them just do the normal thing, even stones, there are stones there. They don't have to carry the toys from home and all that. Let them also not share and the like. The rest you will actually be able to read and to read the document on your own. The temporary room, that room, just a room is important in our institution to make sure as directors, we have instructed our head teachers that they need that room in case a child is unwell. That is the place where that child will be kept, or even non-teaching staff or teacher, should there be any problem. And then our health facility, I'm sure by now, all our institutions are already linked, and we are happy the Ministry of Health has really supported. I found in Kerisho, they have done that. They have even allocated schools to particular health worker and all that. So that is very key because of the response, and our parents and everybody will have the confidence with the measures that we have actually put. So that is about that, the health facility where learners can be attended to in the event of illness. Some of these measures, by the way, they'll still be useful for us, not only for COVID. They are things that need to be continued because these are health hygiene protocols. And we also realize diseases in the country, the normal diseases have decreased. That is why some hospitals were also saying people are not coming to the hospital because we have become very healthy by washing our hands. We have become very compliant and all that. So this one should just continue and become part and the parcel of us. The other thing is about our waste. Ensure proper waste collection, transfer, and management, and all that. And in all circumstances, let us ensure we are also having the e-learning programs, the offline learning programs, and all that. Basically, there could be some children who may not be able to come to school for one reason or the other. So we need also to take care of them and be able to identify them and support them to continue learning. Initially, we were supposed to have done a risk assessment. I'm sure you did that, and you have already done the risk assessment. You have also developed mitigation measures, and you are now putting in place those containment measures that are going to help prevent the spread of COVID-19 once our institutions resume. About the security and the safety measures in our schools, that one is expected to be there. If we have a gate, let it also be manned. Let's also mark the entry, the exit point, and all that. As much as possible, if it is possible, people who are entering in should not also meet with those people who are coming in, if it would be possible. And let us restrict entrance of visitors in the institution. Those ones, let's not have them. Strengthen the guidance and counseling departments, the chaplains, and all that. I think I will not go into those details. About networking, let us also network. Let us partner with NGOs, with CBOs, faith-based organizations, other institutions, because this is actually something that has come to us and we need to tackle it from all sides. Let us also ensure that annual general meetings, I'm sure with the private schools, they rarely call parents in schools. So I think this is not a thing for private schools, but those who call these parents, for the time being, let us still just continue using the online platforms and the like, so that we can avoid gathering of large crowds in our institutions. And don't forget to submit your reports. As the schools reopen, it will be important for the Ministry of Education to know how runners are reporting. Remember, once schools reopen, key fundamental thing will be to monitor their health indicators. It is to monitor, are they okay? That would be the key importance of the manager, the director. You should actually be following with the head teachers on a daily basis or even hourly basis. Are our children okay? What is happening? Are our teachers okay? Because the health safety of teachers remain paramount. So we also have the protocols themselves. I would simply not take you through all those protocols because we can take long. But because you have the presentation with you, you will just go through them one by one. What I want to say here is that we have those social distancing protocols. We have for hygiene, sanitation protocols, respiratory protocols, hand hygiene, the mental health, psychosocial, spiritual services protocols. They're actually in the guideline. This guideline which the CEO shared with you. So you'll be able to read that. When we are talking about the social distancing protocols, it is now, let's say, the classrooms, how will you behave, what will be there in the boarding facility, in the toilet, learner transport, institutional groundwater, waste management, how do we behave in co-curricular activities and all that, what will happen. So I don't want to look at each protocol because for the interest of time and all that. But I want to say specifically, all those protocols that are in the guideline provide or require, whether you are in the toilet, whether you are in the dining hall, whether you are in the laboratory, whether you are in the staff room, whether you are in the library or classroom or wherever you are, you maintain that social distance, the physical distance that we have been talking about. About hand washing facilities. Hand washing facility must be at strategic points. Like in the toilets, we must have those hand washing facilities. If it is in the classrooms, those facilities must be there. Allowed the office, allowed the library, allowed every other place. In the playground, those hand washing facilities must be there. And there must be, and the water for washing must actually run. We were told this, we must emphasize, it is adequate running water, not in the bay, not in the basin. Soap must also be there. In all these protocols, you will find that even in the bus, when learners are entering the bus, they must first wash their hands or sanitize. And even when they come out, they must actually do that and all that. So what we are saying is soap, sanitizers, or wherever the water. In all these infrastructural areas, we must ensure they are there. In all those protocols, you will find daily cleaning and the disinfection of classrooms, of dining hall, of wherever, of toilet. So if you read them specifically, you'll be able to see that. Clear markings from the gate in the school compound. Let those markings be made. I found it is not even very expensive to put those marks. One of the school, you just use the paint, e-paint, and it does not come out. Paint to unaweka, it does not come out. It is actually permanent. And that marking is very important because it will show us where where children are supposed to pass through and all that. In all those protocols, you will also find the communication messages. The communication messages. If it is in the classroom, let's fight. COVID is real. Wash your hands. Let's have those messages in the bus. Allowed where the children are waiting to board the bus. Those markings, let them be there. Those messages, let them be there. And I'm happy Dr. Ali has also promised to give us some messages, which will also be distributed to all of us. In all those areas, ventilation. Ventilation. I don't know, Dr. Ali, we were also told COVID-19 is also airborne. Is that so? Yeah, it is also airborne. So let us ensure everywhere it's well ventilated. It is well ventilated. The grills that we have put in the classrooms, those ones should not be there in any case, because we should actually have windows that are well ventilated, that can open outwards and all that. Waste collection bins. In all these places, even if next to the toilet, at the gate, everywhere, let's have those bins, however they look like, even if it is whatever it is. The reason is because some of our schools have even very young children. They can just pick something on the ground, and that thing they have picked, it is already having a virus, and then they get infected. So it is good to make sure these waste bins are all over, and the people also come to understand that this dropping of waste anyhow, anywhere, it is not acceptable, because you are risking the life of others. No sharing, that one we have said. So those are basically the protocols. I'll not take you through each, but the presentation you have has all these protocols for each and everything, the dining hall, the boarding, the toilets, and the like. And we are also available for any consultation, anything that you'd want to know. We are there, and we shall support you in everything. As I said in the beginning, we appreciate and we recognize the importance of the private sector, because we really do a lot, and we are working towards a common objective of achieving inclusive quality education for all. So thank you very much for listening.
Thank you very much. Thank you very much, Madam Anne Gashoya. For your information, she is the author of the Ministry of Education Guidelines to Schools. So she is the one who has prepared all these guidelines. And we have the recording with us. This meeting is being recorded. Secondly, the guidelines will also be posted to your WhatsApp group, and you can follow them from there, or you can be able to download them and follow them. Questions, we'll answer them at the end of this session. I hope you are still awake And with me, our next facilitator is Lydia Chege. She's a senior manager in charge of research, assessment, and partnerships at the Kenya Institute of Special Education. She is a consultant in matters of special needs education, disability matters around youth and children. She's a psychological counselor. She is passionate about special needs education. Very, very passionate. It's her heartbeat. She is married with 2 children. She is also a grandmother of 1 grandson, and she is a high school teacher by training. Directors, let us welcome Lydia Chege. Okay. Sorry for that. I'm told Lydia will still enjoy her seat for the time being, but because of time, one of our facilitators has requested to be allowed to do her presentation. She is Josephine Ondiek from the Ministry of Education, and she's going to discuss about psychosocial support services for learners and staff in private schools. Welcome, Josephine Ondiek.
Thank you. Good afternoon, colleagues. Is my presentation here? It should be here. Okay. As I wait for, I don't know, I want to say that since COVID, this was March when, or December, or January, the life of all of us changed. These are the managers and owners of schools. Your life changed when the president announced schools must close. All of us, our lives changed. The programs we had changed. We started to process mentally. We did not even know the meaning. And that is the time all of us realized, for the first time, life can change within a second or a split of a minute. And then with that, we had many more challenges. Everybody, I can say that everybody had a challenge. We all had mental challenge because we were not used to certain practices of life. Then we were told, stay at home. Some of us ran very fast to our rural homes so that we could stay at home from Nairobi. And life was never the same again. We even got used. I stayed home for 3 months myself. But while at home, I was working very, very, very hard. Actually, while at home, we developed the emergency plan between us, which now we are using, the ministry is using from wherever that is. Did you share Annie?
Yes. Together with
Yeah. So before we never talked about mental health. Even if we knew in the society we have such kind of challenges or problems, but with COVID-19, this is a discussion which we'll continue discussing about, even in our institutions. It's no longer cognitive alone, because cognitive alone, the child needs much more than cognitive, because there are more challenges at home, at school, coming to school, the child was at home and all that. So this is a discussion which all of us will continue discussing, but I will just briefly, for now, I will just briefly go through it. And as school owners, directors, managers, what must be in our mind is that we cannot offer education alone without moving out of education and look at the need of this individual child, it's now much more. So if you allow me very fast, I'll go through some very, very key slides. I may not go through each and every slide. And maybe in future, we can keep on this discussion, because this is a discussion which should be part of us in our homes, in our schools, everywhere we are. We are saying that mental health is a state of well-being where one realizes his or her own potential to cope with the normal stress of life, personal development, work productivity, etc. And that's what we did. All of us had to cope with the situation which we were faced with. Mental health impacts on one's physical, mental, social, emotional well-being. We are surrounded with all that. So we need to be able to process that one. Mental health issues can be brought about by stress, anxiety, depression, trauma, and pandemics, among others. In this case, we are talking about pandemics. We could have had many other things, but this particular case, we are talking about pandemic. I can also say that mental health awareness promotes how well an individual overcomes psychological challenges that are likely to interfere with one's psychological health, because we are talking about our well-being. We are talking about our children's well-being, which is very, very important. During a crisis which we had, such as a pandemic, like this one of COVID-19, experiences people go through are likely to have a negative psychological impact on their well-being. You had, even when people had everything in their homes, the fact that they must stay in their homes and in their houses, it had a psychological effect. I don't want to come up to go through the session objectives, but the areas we need to cover: psychological impact of COVID-19, COVID-19 risk assessment. Anne has talked about the risk, and we may not go in details about the risk assessment, but we'll touch on that. And in our training modules, in every module, on the appendix, I think number 1, we have a risk assessment tool, which you can look through that and see. And we want to think about strengthening guidance and counseling in our institutions, because that is something we must put effort to, even if it means contacting the parents. You saw how the parents were not able to manage their children very well. This is a discussion we have to have with the parents and say, if as a school you need to have somebody who has been well trained on guidance and counseling, or a counselor, for the sake of the children, and that is for the sake of the parents, that's a discussion we are going to have. So we want to look at the meaning of psychosocial support. What does it mean? Psychosocial support refers to compassion, care, and protection that enhance the cognitive, the physical, emotional, social, and spiritual well-being of a person. So a person, all these in wholesale or in pieces or in parts form part of a person, which we may not ignore. Again, effective psychosocial support should be age appropriate. For example, in our schools, we cannot maybe guide or counsel the children in totality. A grade 1 may need a different kind of unpacking, because whatever the child, the world of the child is not so big, it's very limited. So that's why it is very much to be gender sensitive and age appropriate. Gender sensitive, the boys may need something different from the girls. So when a program, that's why we will encourage you as school managers to have programs, specific programs for this time, for this week, for helping these children. Because if you don't help them, even what they are learning may not help them so much, and you may be having a time bomb in your school. We realize that during this time, some, not many, a few children committed suicide. Why? We never heard of very young children committing suicide. It's because they don't have that social support system. So as a school, you have to create that social support system to focus on this. Age appropriate, gender sensitive within cultural context, because like here in Nairobi, you may be having children coming from different backgrounds, and from different backgrounds, they have been socio-oriented differently. So that's why we are talking about cultural context. So psychosocial support should be aligned to the need, policies and guidelines requirement for learners and the staff that are affected by COVID-19. So again, you may not be dealing with learners alone. You are also dealing with the teachers. Because as we even saw, some teachers lost income, maybe they're coming back, they may be having debts, they may be having several issues as a human being. So as an institution, I think it's a bigger challenge to be able to focus on that. We want to look at what was now the impact of psychological impact of COVID-19. We are saying that COVID-19 affected the way of life of people, and the measures taken to curb the disease affected individuals, rituals, and routines. Our routines were affected. Some of the negative impact of COVID-19 included stress and depression. Some of us were stressed, even if we did not reach the level of depression. Some went to the level of depression. We feared anxiety. Even now we are fearing that the second wave may be coming back. What's going to happen to us? What is going to happen to whatever we are doing to our children? Uncertainty about the future also came, that trauma. Some people had suicide tendencies. There was anger and frustration. So the impact of COVID-19 was much more to individuals, to this country, and to families, and to everybody. What is trauma? We don't, and then we want to, the causes of trauma, we may note loss of loved ones, sickness, economic loss. And then we want to look at now, how do we now package this psychosocial support? I'm just running through very few lines so that we focus ourselves on that. Otherwise, when you talk about psychosocial support, you need maybe 2 or 3 days. So I just picked what was relevant to this group. Strengthening guidance and counseling departments in our schools. I don't know whether in private schools we have this. We even have a challenge in public schools on this, what we call guidance and counseling. Even setting aside a room, having a qualified person, a qualified teacher, a qualified person you engage. That's why I'm saying that as private entrepreneur, you need to have a discussion with the parents. And I'm sure even the Ministry of Education will be having a discussion, because they start now, TSC is saying that we need to identify these teachers of guidance and counseling, and they have trained them. So in a private institutions, you need to be more strategic, because you can make your own decision for that school. You can set a role model, you can be a role model. Even the public schools can learn from you, because it is your decision, and that I don't depend on another person to come and give me policies for this school. Of course, I will work in line with the government, but there are some extra things I can do to role model for others. I think that's important. So we need to be able to disseminate of child-friendly psychosocial messages to the learners. The messages we have talked about since morning, Dr. talked about the messages, Anna's talked about the messages. The messages are very important in a school environment, because that's how we learn. And the repeated messages will be internalized and will be practiced. Adopt continuous health monitoring of all staff, members, and learners, stroke trainers. So health monitoring in school, we cannot afford that on this, when we have this challenge of COVID-19, which keep on monitoring the children, even the teachers themselves, the support staff, how are they doing? Because of course, we have the aftermath of the pandemic, or the pandemic is still here with us. Management to provide face masks to all staff. I don't know whether that one is very possible, but I was very sad when I saw some children going to school without masks. And I know even in private schools, you are not, that will be psychological also. Even you saw another child who took a leave. And I was saying, can we know that child? Surely we know that child will provide with face masks. It is so sad. Even in your institutions, even if you are a private, not all the parents may provide the face masks. That will be an issue of trauma or an issue of a psychological effect to a child. So as a school, are you going to put some measures in case a child comes without a mask, ama imepotea akikuja shule? So what do? Do you have some face masks somewhere where you can, because that one, the child will already can be mocked by others and all that. So those are some of the issues to be able to manage this, because that is practical. A mask is practical. If I don't have it, sinaonekana. So if inaonekana, it gives me a psychological effect, and others may use it, you know, like other children. So we'll be able to look at that. And have a system where you identify learners with stress and trauma and develop psychosocial programs in your school. You will have a system or a qualified teacher who may be able to do that, or a psychologist or a counselor. I think it's a discussion you need to have with the parents, that you may need to employ an extra person to specifically help the children deal with this situation. So it's something you can front. If they accept, that will be okay. So this one, I don't need to go about, through that one, because yeah. Psychological, emotional, and the physical effects. Of course, the effects of mental or psychological well-being or psychological challenges, stress, depression, feeling of confusion, anger, and frustration, loneliness. When you see a child lonely or a teacher very lonely somewhere and doing work alone, they may be, that is an indicator of a psychological problem, fear of the unknown, uncertainty about the future, anxiety, worry, substance abuse, some do that, child abuse, family conflict, incest, stigma, and so many other. Even loss of power and control, lack of psychological space, lack of social support, all that are effects of psychological, emotional, and physical stress. So what are now the physical symptoms? I may not go through that one also, because we have physical symptoms, which you all know. Somebody may not be able to sleep and all that. Economical impacts, loss of income, loss of opportunity, loss of property. This one affected us very well here, as we are seated as proprietors or owners of schools. We had this economic impact to us because we earn our money from operating the schools. So without operating the schools, you can't pay teachers and you cannot do so many other things. So what are we saying? We are saying the above issues brought about overwhelming feelings, which may lead to poor mental health to individuals, since the mind has been challenged and likely experience pressure. When the mind is challenged, there's pressure. As a result of all this, there is a likelihood of increased cases of indiscipline in our schools. Because if the children are challenged and they are pressed, then we may have indiscipline in our e-health, mental disturbance, stress and depression, post-traumatic stress disorder, acute stress disorder, and poor academic and work performance. I think even the fact that the children have stayed at home for 7 months, and you know, at home, the life is comfortable than the life in school. Maybe for some, the life was uncomfortable. You know, some, the life was very comfortable. Some, the life was very uncomfortable. So for those ones, the life was very comfortable. When they come to school, they will have that psychological challenge. So you must be able to help these children adjust to the new normal in school now. Because even I had some children who are saying, I don't want to go to school. Why? Because at home they can eat, they can cook, they are free, they can watch television, they can sleep long hours. But now when it comes to school, they have to wake up very early in the morning and all that. So these are some of the indicators you will be looking at the learners, and that's why you need somebody who may be able to identify somebody today is lonely. I know it is going to be difficult, but it's good to be aware, because they can't learn if they are psychologically affected. And even if they learn, then they may be affected somehow in the future. So that's why we are saying, therefore, there is a need for psychological therapy to avert these effects to adapt effectively in the new normal. Strengthening guidance and counseling in institutions of learning would be a prerequisite in the management of the impact of COVID-19. So this may not be even a very big option. This is something we have to purpose to do. Because if we love the children and we want them to do well, if they must perform, then we must help them live with the new normal. So guidance and counseling may be very, very key in our institutions. So what counseling in the context of COVID-19, what we are saying is that the negative impact of COVID-19 would require interventions to cope effectively. Offering counseling services will avert this effect. Some of the benefits of counseling include a child is able to maintain emotional balance and the mental health if that child is counseled well. It promotes well-being. And actually, I am concentrating more on children, but even our teachers, even ourselves. A counselor once told me that even myself, sometimes I need counseling. I go to a room and I cry because after hearing so many cases from clients, it also affects you. Your psychological, your mental processes, and then you also need to be counseled. So all of us are vulnerable, and at a certain point, we may need to somebody look at us and say, this one needs to be, go for a holiday, want to take this somewhere. Even small things can impact the stress, can impact the stress from a person. Even can impact the stress from the children. Small things even you do. I see private schools even taking children to tours, to animal orphanage. It impacts them from the stress they may be undergoing. So the small things you do, you may think they are not very important, but they are very, very important. Even the parents should know that they are very, very important. Yeah. So productive management of trauma creates self-awareness, acceptance, relieves anxiety and fear, coping with the new normal, over support and comfort, and all that. All these are in the notes, so we will look at them and see what we can do. Individuals who have gone through trauma may exhibit the following signs: intense feelings of distress, extreme physical reactions like pounding of the heart, invasive upsetting memories, hyperarousal, anxiety. All this comes up when somebody is really traumatized. So in a school situation, it's not always that teachers should punish a child who exhibits some kind of negative behavior. The teacher should be able to guide, because some of this negative behavior may be coming from trauma. So we have what we call, on the same line, we have what we call psychological debriefing. If the individuals are not supported to deal with the impact of trauma, they are likely to experience post-traumatic stress disorder. Hence, the need for psychosocial support in form of psychological first aid. It's called psychological first aid, PFA. It's an important approach of assisting individuals in the immediate aftermath of disaster, pandemic. It reduces the distress caused by the traumatic experience for adaptive functioning and coping. Here is where all of us are going to agree. All of us are coming from this traumatic experience of the pandemic. Staying at home for 7 months, that is almost the whole year. For our teachers, even for ourselves, even us as managers or owners of the school, we may need to debrief ourselves, because we are coming from that traumatic. We don't even have money to start schools. The parents are not even paying school fees because now they're saying we don't have money. Okay, some children you have, their parents lost their jobs. Those are issues. So we have to deal with them. We have to be aware of them. First of all, is the psychological issue is that you must be aware that this one may be happening to us, to me, to the teachers, to the children. How do we get out of it? Then what are the benefits of psychological debriefing? Help in coping with the trauma, acceptance of the situation, burns of negative energy, brings harmony between the thoughts, emotions, and reactions, helps normalize individual reactions, helps in calming the mind, make meaning out of the situation, get group support, even the way you have come here today to listen to this as a group, even if we don't have these psychological issues, it helps us, because I will get another manager or another proprietor who will tell me, this is very simple, I've done this and this, I've put these measures, I can move on. So that one helps you to also see and do something to that effect. So we can move on. That one I talked about. So we have another slide down here. Psychological well-being refers to positive mental states such as happiness. It can also be referred to the subjective view of happiness, which has an effect component and a cognitive component, satisfaction with life. That is well-being. You are satisfied. You don't have much anxiety. You say, if the situation is like this, I'll deal with this and then move on. How to achieve psychological well-being? Find meaning in life, meditation. That is what now we can tell our teachers, we can tell ourselves, we can tell our children. I don't know whether we tell our children or we help our children achieve that. Self-care, eating well, exercise is very important. Setting boundaries. Nobody will, you cannot, or somebody cannot come beyond the boundaries you have set. Finding a support system. Support system is very important. We cannot live alone. Even those children we have to look whether they have that support system. Do they have support system in their homes? If they don't have support system in their homes, what do we do? How do we parent them, guide them, and all that? Because this one also debriefs somebody. Connect with others, being active, learning a new skill, and all that. These are things we may be telling our teachers. I really characteristics of psychological health individuals. I don't know. This one we can read. I don't want to, to go through. How much time do I have, Anne? Okay, we can read that one. Yes. So what we are actually saying, I am going to leave this note with you. So I think we can go through them, and we are available for any questions online, wherever. We are always available. But let me read this last one. The following interventions can be used in mitigating COVID-19, constituting a multidisciplinary COVID-19 response team, and utilize the guidance and the counseling departments. I don't know whether you have that team or a committee in your school, so it may be important to have that one. Establishing a COVID-19 gender-based violence desk and keep relevant data. I don't know whether in your school, it may be necessary. Gender-based, because the children may have been abused at home and all that. Carrying out COVID-19 and trauma risk assessment, and that one I said, you can get it in our appendices of our training manuals. I may not go through that because it is very simple. It needs, you will check on classrooms, sanitation, you will check on those things, meals, school transport. You will assess the risk in school transport. Are they congested? How do they come in and all that? In sanitation, do you have enough toilets? Toilet paper, maji, things like that. You make a risk assessment. But the tool, we have appendices in our tools, can really help you. I don't need to go through that. You can refer to the guidelines, and that will be fine. Otherwise, because of time, and thank you very much for listening. We are together in this. I rest my case. Thank you. I rest my case. I don't like unpacking myself so much. That's why I was so before introduced.
Okay. Thank you very much. Thank you very much, Madam Josephine Ondiek. We will now, in the next 5 minutes, we'll answer some questions before we have Eileen Tayari from a TSC Tiari from TSC. So if there are any questions you would like to ask, please raise up your hand. We will also be checking the questions that were asked in our social media pages. This is because our Ministry of Education officials would like to go back. They have other engagements and would not like to keep on keeping them here. So if there are any questions, please feel free to ask. There is a question as per our WhatsApp chat, as per our link chat. What is, meanwhile, our facilitators? Just 2 questions and then we will call Madam Eileen. There is a question. What is the recommended fluid for fumigation? I'll request one of our facilitators to answer that. What is the recommended fluid for fumigation? How long should children stay? The fluid or liquid. The next question from our chat is, how long should children stay in masks? And the third question is, the second question is, how long should children stay in masks, wearing masks? How long can they stay having them? And the last one, you said we should restrict learners with toys from home. What about their snacks and packed lunch? Can they also be allowed to bring them from home? I will call Dr. Ann Mwangi to answer those questions as we prepare for our next facilitator, Eileen Tiari. Welcome, Dr. Ann Mwangi. The first question was, what is the recommended fluid for fumigation? The second one is, how long should children stay wearing masks? And the last one is, should we restrict learners? You said we should restrict learners with toys from home. What about their snacks and packed lunch? Welcome, Daktari. Please keep on sending your questions, your clarifications, or any concern that you might be having. Welcome.
Good afternoon, and thank you for those questions. I'll start with the first question, which was asking about the liquid to be used. The WHO recommends the use of the sodium hypochlorite, which the normal bleach, but there's a certain there's a way, the dilution of the normal bleach that we use at home. So that is the one that is used, but the dilutions, then you have to get the instructions as per the manufacturer of how to dilute the liquid. The other one is on how long a child should wear a mask. I know it's very uncomfortable to be on a mask the whole day, but basically they should wear the mask as long as they're in school. Allowing the teachers can assess and allow periods where children maybe can walk to the field, and maintaining social distance, remove and take a breather. But ideally, as long as they're in the class or they're in the dormitory, wherever they're interacting with others, they should ensure that they are wearing the masks. In regard to toys, I know there are schools where there are no meals in the school, so I think it would be very difficult to give a blanket guidance that nobody should bring food to school. It's still maintaining social distance when they are feeding. If the toys within the school should be cleaned, the ones that, especially for preschools, they should be cleaned and disinfected after use. Also, the teachers or whoever is in charge of these young children should limit the sharing, so that if there are toys in the class, if a child is playing with one toy, then they stick to their toy without, because the sharing, and that is where we are likely to have the transfer of any droplets that may be on the toys from one child to the next one. Bringing toys from home, the challenge would be, maybe the child comes, the the toy may also be touched by other children in school. It may go back home before it is cleaned and disinfected. So that also raises the issue of that you can also take an infection back home. So it is good to keep what is in school, and what is at home to be kept at home. So I think that is basically why maybe that recommendation was given, so that the toys, because the school is likely to be much more in charge of the toys and the play items that belong to the school. They can wash them, clean them, and keep them ready in the school for the children to use them when they come back to school the following morning. So thank you very much. I think I've addressed the 3 questions. Thank you.
Thank you very much, Dr. Anne Mwangi from Ministry of Health. We'll just have a small alteration of our program. We are going to call in Lydia Chege for a 5-minute presentation on reopening consideration for special needs education. And thereafter, we shall have a 10 minutes presentation from alternative modes of curriculum delivery. Lydia Chege, please welcome from Kpsa.
Good afternoon, everybody. Good afternoon. Yeah, I have 5 minutes, and I'll start my 5 minutes by saying that a population that is always omitted from daily conversations, especially around pandemic, like COVID-19, is the population around special needs and disability. And therefore, this morning, I was actually invited to this meeting last night, very late in the night. And this morning, I woke up and I said, I'm not going to make a PowerPoint slide because I want us to have a heart-to-heart discussion around this particular area. And what I would like to say is that COVID-19 seems to be a very bad thing. Yes, it is bad. But again, we can count ourselves lucky in this sense. According to historians, which I am one of them, pandemics come around every 100 years. And therefore, you're not likely to live through another pandemic because you're not in the era of Moses and the others. And COVID-19 has also created room for us to be able to amplify the gaps that have always existed, but somehow they manage to be swept under the carpet. And some of the gaps that have always existed, allow me to say this with a lot of humility and awareness of, I'm talking to owners of schools, is that we have not gone through maybe economic empowerment as a team. And that is why Eva Nyoike and Lydia Chege, being sisters and the only children of their mother, ran a school. And then COVID-19 happened. And then you know what that meant, that the whole home went jobless. Having said that, let me go to what I want to present this afternoon. As we open school, when the CS Magoha will guide us to open schools, for the rest of the children who have not opened the school, and as we open the school for those children who are already in school, we are faced with the following issues. Lost routine for children with special needs and disability, and definitely lost milestones, true or false. So even as we are being told that children will be, I don't know whether we are gauging, we are assessing, we are doing what, please don't look for the mean. Please don't look for good performance. Just look for that my children, I call them so because I have a passion about children with disabilities and special needs, have not lost the milestones 100%. You're also going to meet and deal with children who have new routines. New routines in terms of when they wake up, when they sleep, when they do what. And you know, some of these children with disabilities, and especially children with neurodevelopmental disabilities, who are the most to be found in private schools, you find that these new routines, we warm up slowly. We warm up slowly. And then we cool down slowly. So remember the routine was disrupted 7 months ago. And because they went and stayed with the other caregivers, not the caregivers they were used to on a daily basis, then they have new routines. And you'll be reintroducing some routines that you had before that. We tried to reach out to some of the parents during the COVID-19 total lockdown of, let me say, of the country. And some of the parents would say, please do not translate me into a teacher. I cannot be a teacher and be a parent at the same time. What do you do with these children? And you see, you're running webinars from the comfort of your house, and you would feel them. And as the presenter before me said, you feel like you want to get yourself to a space and cry out, because even as you're holding that webinar, the parent is literally running around with the laptop because they want to hear the next thing you're going to say, and they're also running after the child. Very bad scenarios I've had to deal with in the last 7 months, where a child with ADHD, and I'm sure they are there in the schools where you're heading or the schools that you own, the parent just says, my child says, this being locked in this space is so shocking. And when it is time to sleep, everybody goes to sleep, and this child doesn't go to sleep. They say, I want to dance so that I can be tired so that I can sleep. I hope you understand that these children who are hyper have too much energy that has to be dispensed of. But instead of the child dancing, they put the volume of everything up, open the gate, open the door, open the gate, and take a walk. My dear parents, I'll call you soon. You can imagine, where does this child walk at 11 in the night? What were they exposed to at that time as they walked? So again, you're bringing them back to school and you want them to sit. Definitely, you're going to experience a lot of out-of-seat behaviors. What are you going to do about it? Are you going to punish them? You punish them by sending them out. They will open all those taps that the ministry has said, put taps. And that brings me back to the soap you're supposed to be putting. And the soap we were told to buy, and Gashoya, we were told to buy liquid soap. And liquid soap is very nice because it's colored. It's blue, it's green, it's yellow. Have you seen that soap? Yes. So you can imagine what my children will do. We'll be pressing each of those colors of those soaps to see whether they are the same and whether they do the same thing. Are you going to punish them? Are you going to take them to the sick bay? Are you going to take them to the quarantine center? I don't know. But this is what I want to swamp you with as you sit here and as you listen to me virtually, because we are going to get ourselves to the new normal. And as Madam Josephine Ondieki has said, oh, psychological support is going to be the next big thing. Please call me. Let's walk through this journey, because it's going to be the next big thing. It's not about the coverage of the syllabus. It's about you're dealing with a parent who is already overwhelmed. You're dealing with a parent who is already stressed, and you're dealing with a child who doesn't know whether they are stressed, but they're acting it out because that's the best way that they can explain. I can see my minutes are running out. Allow me, Joanne, to say this, that we are going to have children who have comorbid conditions because they were already there. But on top of the comorbid means, Daktari, that there is already an existing situation, and then now there is COVID. Are we together? And then there's a psychological one. So you're going to have children who are going to have those kind of situations. What are we going to do about them? Most of these things I'll not answer. I'll leave them to you as questions that you may look through them. We have issues around what we've been told, wearing of face shields. You can imagine there'll be goggles. You can imagine what we are going to do with them. Let me not talk about what children with autism will do with those goggles. But let me bring up the serious issue of the children who are drooling. What are we going to do about them? Daktari, what are we going to do about them? I have to pose these questions because these are questions I've been trying to answer for the last 3 months. We carried out a study and we were trying to see what is happening with these children. And one of the things we came up with is that school would be the rescue point. And therefore, for me, as everybody worries about opening of schools, I'm glad that the children are coming back to school, because it might be 100% safer in school than anywhere else. Imagine that is how much parents value you. You'd better be happy about it. Are children going to carry sanitizers? If they carry, will they use them on the hands, or will they drink a little bit of it? So be sure that you're going to have a little drunk children when they come back. I'm not talking about the ordinary children. I'm talking about the special needs children. And it's not because they have disabilities. What do you expect the gifted and talented child will do? They'll be trying to make their own sanitizers. And we already have on YouTube, we already know how to make sanitizers. But they're going to increase something because gifted and talented children are there to be innovators. So directors and owners of schools, please give room to these children and guide them with a lot of love. But also, as the counselor has said, if you thought you had stress, please prepare yourself for the next level of stress. You'll be stressed by children. Learn to laugh with them and let it pass. And when you punish with love. A lot of guidance will be required around that. Please be ready for blended learning, because the good doctor has said, if Lydia is sick and she's the teacher, let her stay at home, but let her earn her daily bread. Because the Solonians tells us, if you don't work, don't eat. But Lydia needs to eat, and we desperately need to eat as we are getting into the new normal. So have blended learning. What does that mean? Invest a lot in ICT infrastructure and come to talk to those people who have been learning online classes. And now let your teachers be in online classes. If you never used to practice core teaching, please practice core teaching so that when Lydia gets totally down, then Eva can take over the lesson from where Lydia stopped. And the beauty of online teaching is that you can be able to supervise from the comfort of everywhere you are. But also, the children will not lose. So blended learning is no longer an option, but the highway to go, where the children will come to school, the children will carry some work either on WhatsApp or whatever, but we still have to, we have to make a few people rich because we have to get onto the Zoom platforms. Unfortunately, this is the new normal. There is need for us to have the children assessed again. So we need to do what kind of assessment? We need to have functional assessment done. It could be done by the experts, the CSO, SNEs, but it could also be done by a multidisciplinary team within your school. So you need to do functional assessment and you need to do educational assessment. Please remember, assessment is not complete for a child with special needs or a child with a disability until you understand what functionally, what can they be able to do, and academically, how much can they achieve at this particular time. Maybe as I close down, the referral issue has been talked about, but have a tete-a-tete with the parents. We've been told by Madam, is it Gashoya who said, private schools have AGMs. I believe I'm right, because I have walked a journey with a few of you, and they have big AGM in big ways, actually more than public schools. And we like when we are forced to come. I was told to go to school with my spouse, and we were supposed to show how we eat with our child. And I'll never forget that experience when my daughter was in class 8. Those are many years ago, but it is quite a wonderful experience. So private schools have AGM and wonderful AGMs. Please keep them up. Sometimes it's the only thing that makes us walk with our spouses to school. You know, sports day we come alone. So have a tete-a-tete with the parents. Please have that maybe class or stream AGM with the parents, and specifically pick up the parents of children with special needs and disability. Let them tell you what they have been doing with the child, debrief them, so that you are then creating a room that the school is safe and you're ready for them. Listen to them. And when you listen to them, through this passionate talk, you'll be able to plan for that particular child. Let them know that although their child has special needs, that child is very special to you as a school. You'll be surprised by their kind of response. Have itinerary teachers, if you can be able to, teachers who can visit the child at home at intervals. We are not saying the teacher to go today, tomorrow, and the other day. No, we don't even want that to happen. But if the child is not able to come, the children, Daktari talked, some have a hole in the heart, and maybe they are hospitalized for a very long time. Visit them. It also makes them feel good, and they have an ownership process with you as a person. 5 minutes over. I hope I have preached the gospel. May the Lord bless you.
Thank you very much, Lydia Chege from Kenya Institute of Special Education. For those who need more information, you can get in touch with Eva Naputuni, who is our chair for Special Needs Education. Her number will be posted on the WhatsApp group, and she can also link you up to Lydia Chege. You can also follow her Facebook page. She has got very interesting articles concerning special needs. Our last presenter for today, we are told save the best for last, is Eileen for murdering your name. I'm trying to pronounce it. Tinyari. She is from the Teacher Service Commission, and she's going to do a presentation on alternative modes of curriculum delivery. I believe this name is from the land of champions. Welcome, Madam Eileen. And as she comes, As she comes, if there are any questions or clarifications, to answer them. Madam Eileen.
Thank you very much. You murdered my name by just one letter. So you didn't murder so much. Good afternoon, everybody. Sorry, how are we supposed to start them? Okay, my name is Aileen. My name is Aileen Tinyari. Yes, but niko tayari. Okay, I work with the Teacher Service Commission, but we also work very closely with the Ministry of Education because we both belong together. So I was in the panel that also prepared the modules that we are using today. So mine, I would first want to say that I'm a teacher by profession, and also I'm a member of Kpsa Prospective. I'm a prospective member of this association. So whatever you've been going through as proprietors of schools, I have been with you in emotions. Empathetically, we've been together. But we'll make it, we'll pull through. Nothing is lost, not much is lost. But I want to say that one thing that made or broke us during this time as owners of private schools is one thing called technology, isn't it? You know, there's some schools kept abreast or afloat, even in the situation, but others went underwater because of one thing, technology, or in other words, alternative modes of curriculum delivery. Those who are able to keep in touch with their learners or with their pupils, you still have them with you, isn't it? But there are some who are not able to keep in touch. So there was that gap of 7 months. Some of the schools have lost their learners because of that lack of connection. Ama ni uongo? Si ni kweli? The lack of that lack of connection has affected most of us. And this lack of connection, the gap is filled by the alternative mode of curriculum delivery. You know, when schools were closed in March, by the way, where is my content? Okay. Yeah, I said it up. Okay, when schools closed in March, we were advised, both of private and public, to keep learners active in learning, isn't it? To look for ways of continuing to keep learners on board. So, some were able, others were not able, because of our technological advancement. In Africa, you know, we've not had much of advancement in technology, but this COVID-19 has taught us a big lesson that we need to up our technology, isn't it? And especially in learning. And we need to also think and bring on board alternative modes of curriculum delivery. Now, when we talk of alternative modes of curriculum delivery, there are many, but I want to narrow down to what is possibly applicable to us in our contexts, okay? We have
It's not a slide. Yeah? Use this, yeah? Okay, we have various alternative modes of curriculum delivery, but I'm going to mention them and then I'll concentrate on the one that is that we have exploited in our context. We have the blended learning. We can use blended learning, which we have actually been using. This is where, while in school, while in a classroom situation, we combine both the, or we integrate the online mode or media and also the usual face-to-face learning. Like now, what we are doing here, we are using blended learning. We are using face-to-face and at the same time we are using technology, isn't it? That is what we call blended learning. I don't have to expound on that. Sometimes in schools, teachers might use captured lessons and bring into the classroom for demonstration in a topic. That is also blended, okay? The teacher is there, but he uses something that has been recorded for demonstration to the children. That is blended. Then we have another one called hybrid or flexible learning. This is where learning is done online from home, and learners come to school only when it is very necessary. We know that there are some subjects or aspects of learning that you cannot do wholly online from home. Students need to come and do it practically. Like which one? For example, in secondary school, we have lab practicals, isn't it? Yeah, they have to come and do it practically. So sometimes they have to learn from home, but then other times it is necessary that they come to school and do such. That is what we call hybrid learning. Then we have the one that we've been using during the COVID-19 pandemic period, where the children remained home and teachers also remained home. Everybody remained home. So we went fully online. That one, there's no going to school, but learning is done online from home. And you know the methods that we've been using. Then there is another mode of learning that maybe we can think about as private schools, where it's called institutional clustering program. Institution clustering program. Sorry, I forgot about. Yes, institution clustering program. Here, we cluster institutions according to their proximity and according to their background, about the socioeconomic background, okay? For example, here in Nairobi, you can think of an institution that is similar and close to yours, and because we know this online learning is very expensive in terms of equipment, recording, you know, it is costly. So institutions can come together and share resources and share skills, because you know also in some institutions we lack the skills to develop these online modules, isn't it? So such institutions can come together and share expertise and also share equipment to reduce costs. And then this is used for the online. Okay, click this one. You know, this is not a PowerPoint. Okay, then, okay, we have mobile caravans, but I don't want to talk about it because, yeah, it's okay now.
It's okay. Thank you. I don't want to use us to belabor on this one, mobile caravans, because again, we may not afford it in our context. But if we would afford it, this is where devices, I mean, now a mobile, sorry, we have like a vehicle or caravans fitted with devices, with power, with Wi-Fi, and all that recorded material, and then it is taken to the communities where these kind of learning, like where there is no power, where there is no internet, they are taken there. But I don't want us to use this one. This one is usually used by governments where they are able, okay? Then we have, we look at next, the use of technology. So how are we going to use technology? And I want us to think of the common alternative mode of curriculum delivery in our situation, in our context. Which one do you think is the most applicable in our context? Or which ones? They're fully online, isn't it? We can't use it. If the schools are closed completely and we want learners, and we are told learners must continue learning, we know it has challenges, isn't it? But we can use that one at least. We can't use the caravan, mobile caravan. Logistics will not allow. We can also use the hybrid, can we? We can also use the hybrid, and we can also use we usually use the blended method. So that's why I want us to concentrate on that. So how do you use technology in the curriculum delivery? What do we need? We need tools for resource preparation or resource producing, okay? We need those tools. And what is this we need? To prepare for online lesson, or we need those tools we need to produce a lesson, to prepare a lesson for online presentation or online, for it to reach to the students, we first need to produce it, to create it, okay? So what do we need from there? What do we need? Talk. What do we need?
Internet.
Yes. And okay, we need the presentation recording. We need it to be recorded, isn't it? We may need also screen capture software. We may need video production. Sindio? You have seen, our learners, the good thing is most of our learners, a very high percentage is exposed to use of these online issues, like now WhatsApp. When you send WhatsApp, they can open and watch, isn't it? So if you record something and you send to the learners via WhatsApp. But you see, this is not just the ordinary recording. This is a serious matter. It requires professional way of doing things, isn't it? So that's why, and I believe most of the private schools have ICT specialists. If you don't have, and you better have one, because I think we have learned these lessons from COVID. This is the way we are going now. The technological way, that's how we are going now. We are not going backwards. We will not rely on the old methods of curriculum delivery. So it is important that you have. If you don't have, we have talked about sharing, isn't it? Collaboration, institutional collaboration, isn't it? So, but you need an IT specialist. So you will need that, the preparation of what you're going to to present to the learners. And then you will need the tools of collaboration. These tools of collaboration will include all the types of live streaming software, okay? The software on interactive teaching, because you're not going to use only lecture methods, you also need the interactive teaching, you need remote office, online course, blogs, all that. So I will mention them. We have the web-based learning, we have the tele or video conferencing. You read from the notes what they mean. You have the video conferencing. Of course, there is audio. It is audio and video. Okay, the learners will see the teacher and hear what he's saying and see what he's doing. The audio conferencing, the learners will only hear. Okay, then we have web meetings where the participants will log in and receive the live audio learning and also follow visual materials that appear on the computer screens. This one, I think, is like the one we've been doing on Zoom, okay? Then we have email, where if it is like now you are sending, a teacher wants to send assignments. I'm sure they've been using emails, maybe for the parents, or maybe you can ask your learners to create what? Email, personal emails. Then those are channels of using the technology, I mean online learning. But now we need to be, we can't just prepare online lessons just carelessly. We need to be guided. We need to, that's why we come to the guidelines on using e-learning, okay? We need to, the e-learning should be administered ethically and in safe and secure platforms. This is serious, this is learning, this is information that should be secure. It should not be hijacked and altered. You understand? Because information can be hijacked and altered. And then the learners receive something that was not intended. They receive the wrong material. So we need to observe quite a number of things, and because I don't want to mention them, they are there. You will see there are many guidelines on how to go about it, and this should be made aware to the teachers, to the learners, because now online learning involves not only the learner and the teacher. These days it involves even the parents, isn't it, and the guardians. So all these stakeholders should be informed of how this is going to take place and measures, safety measures to put in place, the kind of equipment they should use, how to use it. You learn from the guidelines that are given there. So first of all, the teachers should be sensitized, the learners should be sensitized, and the parents should be sensitized on how it is going to happen and what they should watch out on, okay? Also, the teachers and the school, the institution, should make sure that the equipment are also safe, okay? Safety of the system, safety of the equipment, safety of the information. And there are various ways of making sure that you prevent online risks, and they are outlined there. I don't want to mention them one by one. They are there. Like now, some people go into restaurants, anywhere, and they open the Wi-Fi and they start learning. Some of them can pick, okay? Also, we should observe the ethics of use of computers and other online communication tools. When teachers are preparing their material, they should be guided that they should avoid copying, because you know this use of online preparation of lessons online can lead someone to use shortcuts. Unachukua kazi ya mtu mwingine and it is copyrighted, unatumia. Next time you hear, you are being sued. So teachers should be guided on such matters. If there is anything that happens in between, if there is, for example, infiltration of information, strange information, it should be reported. The teacher should be told they should be reported, because if the wrong information due to infiltration or even hacking they sent to the students, you know, parents can also sue. What is this kind of material you are sending to my children? So there are so many things we need to take care of before we channel the information to the recipients. They are there, you read about them. Sorry. Then we know, much as we are talking about online learning, it has its challenges, isn't it? And I'm very sure, because you've experienced this, the challenges are myriad. And you can mention them, sorry, okay? You can mention them. You remember them? For example, are you able to reach all your students? Even with the effort that you have made, because I know private schools have really made effort to make sure that learning continues. And learning is not only the learning that is on the textbooks, you know. We have heard that a lot is happening out there. We are losing learners, isn't it, in various ways. Even that should be incorporated in our learning, so that we make sure, even when they are out there, our learners are safe, okay? They are safe, so that you don't lose them. So, so these challenges, I'm expecting you to mention them. You don't reach most of your learners. Why? Reasons. One? Yes, lack of internet connectivities in all areas where they are. Some have, some others don't have. Even power, isn't it? Sometimes even when there is internet connectivity, sometimes the lesson is on and then power goes off. So those are technical hitches that come. So those are some of the challenges. There are very, very, very many. What about readiness of the learners? Are they always ready? What about even readiness of the teachers? Are they prompt? Because they're home and you don't know, you can say, now, today I don't have power. So I am not able to present my lesson. I'm not able to post. I'm not able to do ABCD. So those are some of the challenges that we face with them. Online learning. There are many. You can, we also, Madam Chega talked about learners with disability. It's also a challenge for them. For example, which ones? Which disabilities? The deaf, that is the hearing impaired.
The ones who are deafblind, good sensitive, that need a lot of time.
Yes, those that are even mentally handicapped, the deaf, the blind, visually impaired, the hearing impaired, the mentally handicapped, all those, they have challenges when we come to online learning. Okay, so that, you see, now we are not able to provide education equitably, because when it comes to online, because of those challenges. I don't know how we are going to cover that, but also we also have the challenge with even teachers. I don't know, maybe private schools, you are able to take good teachers, young ones who are technologically avid, but in the public sector, of course, we have teachers across all ages, and of course we have that boundary of those who are not exposed to technology, and for them now it becomes a challenge to use online learning. Those are some of the challenges. They are all there. Now, I want you to do some reflection as indicated there. I also want to give you I want you to give some thought on this. How effective are the alternative modes of curriculum delivery in Kenya? How effective are they? Especially the ones that we are able to use. How effective are they? What solutions can you have on them? So how best can alternative modes of curriculum delivery be used to facilitate continued learning in Kenya? Of course, we get a lot of advice from experience with the private schools, a lot of advice that is put into use. Feedback from the private schools. So also think of how Kenya can build a long-term resilience or resilient education system to facilitate undisrupted learning beyond this period. As a teacher or as a director in your school, are you able to advise learners and teachers and parents on safety, security, and ethics? Are you able? Okay, those are the things maybe we need to think about. And I'm through with my presentation. I'm sorry I thought I would take just 10 minutes. I think I have taken so much time, but whatever the content is more than the minutes I should have taken. You can read from the notes. Thank you very much.
Thank you very much, Madam Aline. Before I call our Nairobi County Chair to close for us with a word of prayer, and at the same time, the Director of Cornerstone, Mr. Buru, will also be getting ready to pray for us, to close for us. There are a few emphases from Madam Anne Gashoya, who said we need to forward to the directors. Number one, we need to emphasize on maintaining physical distance, especially for the pre-primary. Number two, put all other containment measures. This is for the pre-primary. Number three, pre-primary children need not to wear masks. Number four, encourage learning in open spaces, places, fields where possible. In other words, don't keep them in class the whole day. Encourage outside learning. Number five, allow frequent breaks where children can walk out and get fresh air while maintaining physical distance. Lastly, supervise hand washing. Don't tell children to go out and wash their hands and there is no supervisor. There is an emphasis of supervised hand washing. At this moment, I will invite our Nairobi County Chair, Madam Rosebella Ojiambo, who is also the Director of Good Testimony Schools, to give a vote of thanks. I've seen quite a number of questions. I think Kpsa, in their own capacity, will be answering them, hopefully in their website or on the social media pages. Because of time, we cannot answer all these questions, but thank you very much. Welcome, Madam Rose Bella.
Thank you very much, the CEO and the moderator, John, for this opportunity, at least to give a vote of thanks as we close. I want to take this opportunity to thank all the directors for your resilience. We have had the word resilience mentioned by most of our facilitators, that it has taken resilience for us to be alive today and to be able to attend this particular meeting. I take this opportunity to say thank you very much to the facilitators and Daktari. That was very, very informative, especially giving us also the examples of your own children who are in school. Is that you're the doctor and you're also a motivator in that particular manner, and what you have gone through has really been an eye-opener for all of us. So we thank you also, Anne. Anne, I can think is in absentia. She has left. Yeah, she also came out very strongly with a good presentation. That was a big eye-opener, especially to myself. We have been reading the guidelines of the protocols that we've been getting through the Ministry of Education, but it has never been elaborated and broken down and unpackaged in such a manner that she did it. So we take this opportunity. If you meet her, I'm sure you're within the same committee, say we thank her so much. We have also Lydia Chege Kpsa in absentia, and thank you, Evan Naptuni. That is a very great teacher. She said she's a historian, and we can see she's more than a historian. I wonder where the bridge is between history and the Kpsa, but I believe the way she presents herself and the way she has passion for children with disabilities, she would really best fit in Kpsa, because she's very passionate about what she does, and actually she spoke from the heart. She told us she's not going to make a presentation, but she spoke from the heart. Last but not least, we have Aileen. I will not murder your name. It is Ntinya, the N, Tinyari from TSC. Thank you very much. You have taught us. They say that you reserve the best for the last. You have really opened our eyes on the same matter, that when we go out there, we shall make sure we put in place blended learning, hybrid learning, and what was the other one, directors? There was blended learning, hybrid, and? Are they right? Are they right? Institutional clustering. Myself, I normally call it the online learning, blended learning, hybrid learning. So it's actually inevitable because of also children with underlying conditions. I've realized that we cannot do without either blended or hybrid learning, because we shall have children who might never come back to school. We have been told it is the new normal, and we must live with the new normal. The schools are new, the directors are new. I liked it very much when Jocelyn Ondieki talked about the psychosocial support services. As directors, we are talking about psychosocial support for our children and the teachers within us. But I think after 7 months, we also need debriefing ourselves. This is a lot of debriefing for us to accept the new normal and to be able to wade through the challenges in a manner that will come out victorious. They say when you fall, don't just wake up without nothing. When you fall, you wake up with something. I think it is a moment for all of us directors to take this opportunity to learn and accept the realities that change is inevitable. To me personally, I've learned a lot of things. I've kept quiet in my own space, and I was listening to her. She says that sometimes you feel like you are almost alone and you need people to debrief you, but as a director, maybe there'll be very few to do that because they expect information and answers from yourself. I would like to leave you with a parting shot, whereby we say we have been through the COVID era. Now we are almost fully back to school. I want to believe that we are almost fully back to school. What are the lessons you have picked from COVID-19? What are your COVID achievements? Do you have mindset changes? Do you have something that you'd say, I'll do it better? Now given, it's like we have been given a second chance and a second opportunity. When schools closed, to me, it was retirement without a plan. I felt what it means to get retired without a plan, to lose a job, and you did not know you'd lose a job. What would I do if it came again? I would just pick up my pieces and look at another direction and walk on. So the resilience is what we are going to bank on. As we trust in God to take us through this particular period, let us be resilient, because we are taking back a community that we never closed with. When we closed on March 13, we expected to open on March 15. But come March 15, we did not open. We opened the other day. The community that is coming back will need our psychosocial support. We also need the psychosocial support by us coming to this particular meeting. And I want to thank you, Kpsa, for having actually brought about a face-to-face meeting, because we are used to meetings, we're used to seeing people, we're used to talking to people, but it was a time of 7 months whereby we were doing a lot of virtual. something which was not, which was very new. Thank you very much, John. That was good for us. And thank you very much, each one of you who came here, at least to make this as a success, wherever you are. Our members in the Ministry of Education, thank you very, very much for the support you have given us, and you have worked with Kpsa to this particular moment. So thank you again, and may the good Lord bless you. May the Lord of Abraham, Isaac, and Jacob bless you from the crown of your head to the sole of your feet. Shalom, peace, and love to you.
Thank you very much, our Nairobi County Chair, Madam Rosebella. And now I request all of us, wherever we are, even in the house, in school, kindly stand up for a word of prayer as we wait for Mr. Mburu, Martin Mburu, the Director of Cornerstone, to come and close for us with a word of prayer. I will leave you with a saying: no matter the economy of the jungle, the lion will never eat grass. No matter how dry it is in the jungle, the lion will never eat grass. The lion will go and hunt. So directors, get up and go and hunt. You are more than overcomers. I have been your moderator, Joan Godia. Have a lovely week.
Thank you very much. Just a slight correction. My name is Martin Buru from the Corner Brook School. I'm proud to stand here before I say my prayer and say that in the debate that is going on nationally about gender representation, we have oversurpassed that at Kpsa. Today, I'm the 9th speaker and the second male speaker, 22% shareholding of speaking today. And when we analyze it in terms of external speakers who have been invited today, the ladies have it at 100%. Bravo to the ladies. Let us pray. In the name of the Father, and the Son, and the Holy Spirit. Amen. Lord Jesus Christ, we thank you for this moment that you have given us today to meet and to deliberate on our businesses as private school owners. We thank you for the blessings of our visitors from the various sectors of our education, from TSC, from the Ministry of Health, from the Ministry of Education, and even from special education. We thank you, God, for all that blessings. We thank you for the energy and blessings you have given us and the tenacity that you have given us from the time that we closed our schools. In March, we have survived 7 months without knowing how. This is true. We depended on you, and you delivered without failing. We don't believe now the schools have opened. We thank you for that blessings. Now, as we open the schools, we know the pandemic is still with us. We know there is a lot of people waiting on the corners of misbelief, hoping that something goes wrong. And we want you to extend your hand of blessings and say, nothing shall go wrong in all our schools. And our learners shall be safe. And our educators shall be safe. And our classrooms shall be safe. And our institutions shall remain safe. We may use water and soap and other disinfectants. We may use all the sanitizers, but the greatest sanitizer is you and the prayer that we'll be making to you every single day. We ask for your blessings for all the ones who are watching from home and from schools. And we want to ask for your blessings as our learners travel each day, the ones who are in day schools on transport, bless them. And we want you to bless everybody who is partaking in the care of our children in schools and in other institutions, both high school, primary school, and others, to bless them in all ways. And as we go our ways, we ask for journey mercies, and we want to ask for your blessings. We ask you this in the living name of your Son, Jesus Christ, in the name of the Father, and the Son, and the Holy Spirit. All of us say amen. Amen. Amen.
Sote tukaweke vitu kwa tumbo zimekuwa tukateremsha vitu lunch kwa chini. Thank you. So that you can put ground floor and have lunch together.